Did you know that Benjamin Franklin, one of the founding fathers of the United States, suffered from gout? In fact, he claimed he could predict rain by the pain level in his joints. This led to the popular notion of using joint pain as a weather forecaster. Franklin's observations sparked interest in the relationship between weather and health, contributing to the development of meteorology. While Franklin relied on his aching joints to forecast the weather, we've come a long way in understanding arthritis. Today, you don't need to wait for rain to check your joint health. So let me show you 5 quick arthritis tests you can do in just 60 seconds. Hey everyone, welcome back to the channel. If you're new here, make sure you hit that subscribe button and turn on notifications so you don't miss out on any future health tips. Today we're discussing a condition that affects millions worldwide, arthritis. We often link this condition with aging, but the truth is that it can actually affect people of all ages. In this video, you'll discover 5 quick and easy tests that you can do at home to determine whether you might have arthritis. These tests are simple, require no special equipment, and won't take up much of your time. Our first test focuses on joint pain, a common early sign of arthritis. Do you often wake up with stiff joints? This stiffness might be more noticeable in the morning or after periods of inactivity. Pay attention to how long this stiffness lasts. If it's just a few minutes, it could be normal morning stiffness. However, if your joints feel stiff for more than 30 minutes after waking up, it could be a sign of inflammatory arthritis. Inflammatory arthritis, like rheumatoid arthritis, occurs when your immune system mistakenly attacks the lining of your joints. And this attack causes inflammation, leading to pain, stiffness, and swelling in your joints. Now remember this, not all joint pain is created equal, and understanding the type of pain you're experiencing can provide clues about its cause. Arthritis pain can feel like a dull ache, a sharp stabbing sensation, or even a burning sensation in your joints. It might be worse after periods of activity or when you put pressure on the affected joint. Plus, if your joint pain is accompanied by other symptoms like swelling, redness, or warmth around the joint, it's crucial to see a doctor as soon as possible. The reality is dealing with joint pain and stiffness can be incredibly frustrating, but there are simple things you can do at home to find relief. One effective method is heat therapy. It's the practice of applying a warm compress or taking a warm shower. You see, heat can help loosen up those stiff joints, making it easier to move around and start your day. A warm shower in the morning or applying a heating pad to sore joints in the evening can provide soothing relief. Remember, while heat therapy can provide temporary relief, it's essential to address the underlying cause of your joint pain. If you're concerned about arthritis, consult with a healthcare professional for proper diagnosis and treatment. Our next test is the finger-to-nose test, and it helps us assess coordination and identify potential joint issues. This test requires you to touch the tip of your nose. Then repeat this movement with your other arm. Pay close attention to any difficulty or pain you experience while performing this test. If you find it challenging to coordinate this movement, or if you feel pain in your joints, it could indicate an issue with your joints or nerves, possibly related to arthritis. Maintaining flexibility and coordination is crucial for overall joint health. That's why stretching regularly can make a world of difference, especially if you're concerned about arthritis. Simple wrist and finger stretches can improve blood circulation and muscle tension, which are essential for healthy joints. Plus, adding stretches into your daily routine doesn't take much time and can significantly impact your joint health in the long run. Even a few minutes of stretching each day can make a difference, but remember to start slowly and gently, gradually increasing the intensity and duration of your stretches as your flexibility improves. Now you might wonder, how are coordination and arthritis connected? Well, in some cases, arthritis can affect the nerves that control your muscles, leading to coordination problems. This connection highlights the importance of paying attention to even subtle changes in your body. Early detection and intervention are key to managing arthritis and maintaining your quality of life. Remember, the finger-to-nose test is just one piece of the puzzle. If you're concerned about your joint health or notice any changes in your coordination, don't hesitate to visit a healthcare professional. Next, we'll focus on another simple yet revealing assessment, the grip strength test. You see, a decline in grip strength signals potential issues with the small joints in your hands and wrists. This test is particularly relevant because arthritis commonly affects the small joints of the hands, leading to pain, stiffness, and reduced functionality. By assessing your grip strength, you can gain a better understanding of how well these joints are functioning and whether further evaluation may be necessary. Now you might be wondering why grip strength is so important. Well, it's not just about how firmly you can shake someone's hand. A strong grip is crucial for a wide range of everyday activities, from opening jars and carrying groceries to writing and using tools. Performing the grip strength test is incredibly straightforward and requires no special equipment. You can use a simple object like a stress ball or even a rolled-up piece of paper. To begin, hold the object comfortably in your dominant hand. Make sure your wrist is in a neutral position, neither bent nor extended. Now squeeze the object as hard as you can for a few seconds, maintaining a consistent pressure. As you squeeze, pay close attention to any pain, discomfort, or weakness you experience in your hand and wrist. These sensations could indicate underlying joint issues, such as arthritis, that may be affecting your grip strength. It's important to note that grip strength can vary naturally from person to person, influenced by factors like age, gender, and overall fitness level. However, a sudden or gradual decline in your grip strength, especially if accompanied by pain or stiffness, should not be ignored. All right, let's move on to the fourth test, which focuses on swelling. Swelling in your joints, particularly in areas like your fingers, knees, or ankles, can be a telltale sign of inflammation. This is a common symptom across various types of arthritis, so it's important to keep an eye out for it. Why does swelling occur with arthritis, you ask? Well, it's primarily due to an increase in something called synovial fluid. This fluid normally helps lubricate your joints, but when there's inflammation, your body produces more of it, leading to that puffy appearance. In addition to the increased fluid, swelling can also be caused by the accumulation of inflammatory cells in the joint space. These cells are part of your body's immune response, but in the case of arthritis, they can actually contribute to joint damage over time. So, if you notice any unusual swelling in your joints, don't ignore it. It's essential to bring it up with your doctor so they can properly diagnose the cause and recommend the best course of treatment for you. If you're dealing with swelling, cold therapy is a simple and effective way to find relief. To do this, simply apply a cold pack or even a bag of frozen vegetables wrapped in a towel to the affected area for 15 to 20 minutes. Doing so constricts blood vessels, which helps to minimize swelling and that uncomfortable throbbing sensation. Plus, cold therapy can have a numbing effect, temporarily relieving the pain signals being sent from your joints to your brain. Think of it like this. When you sprain your ankle, what's the first thing you do? You ice it. The same principle applies to arthritic swelling. Cold therapy is your best friend when it comes to calming down those inflamed joints. Just remember, always wrap the cold pack in a towel to protect your skin from direct contact and potential ice burns. And listen to your body. If it feels too cold or uncomfortable, shorten the duration or take a break. All right, for our fifth and final test, we're going to focus on the range of motion, which is a fancy way of saying how far you can move your joints in different directions. This is a crucial indicator of joint health, as limited range of motion can be a significant sign of arthritis or other joint issues. Think about all the movements you make throughout the day, bending your knees to walk, raising your arms to reach for something, or even just turning your head. When you have arthritis, inflammation and damage to the cartilage and surrounding tissues can restrict these movements, making everyday tasks more challenging. During this test, you'll want to gently move each joint through its full range of motion. This means bending, straightening, rotating, or moving your joints side to side, depending on the specific joint you're testing. Pay close attention to any pain, stiffness, or difficulty moving a joint through its entire range. Remember, everyone's range of motion is different, so don't compare yourself to others. The key is to be aware of your own body and any changes or limitations you may experience. If you find that your range of motion is limited or you experience pain during these movements, don't panic. There are plenty of things you can do to improve your flexibility and joint health. Incorporating gentle exercises like yoga or Tai Chi into your routine can work wonders for your joints. These practices focus on slow, controlled movements that help to lubricate the joints, reduce stiffness, and improve your overall range of motion. Plus, they're low impact, making them suitable for people of all fitness levels. Remember, maintaining a healthy weight, eating a balanced diet, and avoiding smoking can also benefit your joint health. And as always, if you have any concerns about your joints or experience persistent pain or stiffness, don't hesitate to consult with your doctor. So there you have it, 5 quick and easy arthritis tests you can do right now in your home. If you found these tests helpful, give this video a thumbs up and subscribe to our channel for more informative content on arthritis and overall well-being. And don't forget to hit the notification bell so you never miss an upload. We'd love to hear from you. Share your thoughts on these tests in the comments below. Thanks for watching, and we'll see you in the next video.